chose was called Exercise and Cardiovascular Health by Jill Edwards, and it started with a history of cardiovascular disease, which actually accounts for about 50% of deaths, and nearly 14 million Americans are affected. It is the leading cause of death in the United States, and over the last 40 years, the CDC, the American Center for Sports, the AHA, and the Surgeon General in 1996 reinforced evidence that regular physical activity is linked to cardio health. There's less activity is preventative for other non-cardio chronic diseases such as hypertension, colon cancer, and osteoporosis. But there's a higher rate of cardiovascular events and higher death rate for people with low levels of physical fitness. Even upping activity midlife decreases mortality. So if you start in your mid-40s, and you still work towards fitness, then it'll help you later in life. But most U.S. adults are sedentary, and less than 1/3 meet the minimum recommendation for activity. The benefits of exercise: you can improve muscle strength and function, but it also improves your cardiovascular health. It increases your maximum oxygen consumption, so your ability to transport oxygen and use it. So like when you intake it and then transfer it to your blood, to your muscles. There's less fatigue in daily activities, especially important if you have cardiovascular disease, because exercise capacity is lower. So exercise for your cardio health can actually improve the capacity of blood vessels to dilate, consistent with better vascular wall function, and its important ability to provide oxygen to muscles during exercise. Also, cardiovascular health and exercise increases cardiovascular health, and it also increases exercise tolerance, good HDL cholesterol, increase in insulin sensitivity, reduces body weight, reduces blood pressure, and a reduction in bad cholesterol like LDL in total. It's good to include other healthy factors too, like stress management and sleep and stuff like that. The steps I would recommend for a client from this article as well is to have heart disease. Not to have heart disease. It's to start with just 30 minutes a day of activity, preferably a higher intensity. But if you can't do that, especially just like trying to manage a 30-minute increment, do it in intervals of 10, or walk instead of drive, or take the steps instead of taking the elevator. If you have heart disease or over 45 with 2 or more risk factors such as cigarettes, high blood pressure, diabetes, obesity, and even just a sedentary lifestyle, talk to your doctor before you start an exercise program. I liked this article because of how educational it was. There was a lot of benefits and also laid out the causes and risk factors. Easy action recommendations, very applicable. I think that it would help the clients that aren't very aware of how heart disease affects you and how your cardiovascular health and exercise, your exercise increases your cardiovascular health so as to keep you from dying sooner. All ages, I would recommend this for all ages, but especially the older, because they can build up tolerance, like they have to start at a lower rate, but the younger can prepare ahead, and so if we start now, we'll be good later. I would like to use this article to educate, warn, and give an easy next step. This definitely can convict us about sedentary lifestyles. 3 John 1 verse 2 says, "Beloved, I pray that all may go well with you, and that you may be in good health as it goes well with your soul." In the English Standard Version. Good health is a godly desire, and we should strive for physical endurance as much as we strive for spiritual endurance.